So my name is Christian. I'm the new nutritionist here at Mexico Bariatric Center, and this is the post-op bariatric diet webinar. So a little bit about myself. I have a bachelor's of science in clinical nutrition from UC Davis. Here's my email. Here's my direct line, and also follow us on TikTok if you want to see some more tips and tricks. If you have any medical questions after the surgery, our surgeon liaison, Jen, will help you with them. This is her email, and this is her phone number. So we'll go through the 4 phases of the post-op first, then we'll go with the nutritional goals, and I'll talk a little bit about the vitamins at the end. So the first 7 days following the surgery is the clear liquid phase. This phase starts when you're in the hospital after your leak test, which usually is the day after the surgery. During this phase, proper hydration is very important. And we allow the stomach and digestive tract to rest. The intake goal for the water or liquid is 64 ounces, but a minimum of 48 ounces recommended to prevent dehydration. During this time, make sure you take very small sips. Take a small sip, wait 60 seconds between each sips, and try to do a minimum of 4 ounces per hour. At the beginning, you might feel some discomfort even with water. Don't worry, it's normal. Warm temperatures can soothe and relax the pouch muscles. And also the fluids cannot harm or stretch your pouch. So that's why it's important for these 7 days to just focus on that. Like I said, it's 5 to 7 days, but I would like for you guys to do 7 days at least. Again, like I said, it will help heal. It will help let your digestive tract rest, and that way you can heal better. You can have herbal teas. Make sure they're decaf. You can have fruit juices diluted 50 and 50-50 with water. But if you buy a fruit juice, make sure you get natural fruit juice with no added sugar. Things like grape juice or apple juice are the best. You can do infused waters. You can put an apple, mint, berries, or lemon in the water. Be careful with berries. They have small seeds. If you do, make sure to strain the water. You can have bone or vegetable broth. You can have clear protein waters, sugar-free jello and sugar-free popsicles, or any kind of water flavor that has 0 sugar and 0 calories. Avoid teas like black tea, lemon tea, and hibiscus tea, or any kind of teas that have caffeine. Avoid coffee. Like I said, caffeine is an irritant and dehydrator. Avoid citrus juices and avoid anything carbonated. Both the citrus juices and the carbonation can cause acid reflux, and the carbonation can also affect your stomach. It makes you bloated. It can be painful also. So just make sure you focus on these allowed liquids. Some more example for clear liquids, you can have bone broth, coconut water, Skinny Girl. This is a brand that I recommend. You can have any kind of sports drink that has 0 calories, 0 sugar. And this is one example of the protein water. It's called Protein 2.0. It has only 15 grams of protein, nothing else. After the 7 days of clear liquids, we can move on to the thick liquid phase. Here, it's the goal to increase your protein intake to 60 to 90 grams of protein per day. It's important for you to choose a protein supplement that you enjoy because it's going to help you with satiation. It's going to keep you a little bit fuller. You're not going to be as hungry. And then make sure you choose a protein supplement with at least 20 grams of protein and no more than 5 grams of sugar. 5 and lower is good. Please avoid using a straw. A straw can introduce unwanted air into your pouch and make you bloated. Also, the same thing goes for gum. I know gum doesn't have any calories, but If you chew gum, you introduce unwanted air. Make sure you try to work up your goal for protein in phase 2. Protein aids with the wound healing. It helps you burn fat. And then the hydration goal is still 64 ounces per day. You can begin the vitamin supplements 14 days post-op. During this, you can have things like blended soups. Homemade is the best. You can try to make some bean soups, lentil soups. They're both great. They have fiber, they have protein. It's going to keep you full. You're going to feel like you're eating something finally. You can have some smoothies, but for smoothies, use mainly banana as the fruit if you want to make any. Avoid anything with seeds. Like strawberries have small seeds on their skin. Avoid that. You can have protein shakes and protein powders. You can have plant milks like almond or coconut milk. You can have oatmeal or cream of wheat, sugar-free pudding, plain high-protein yogurt. Usually that's just Greek yogurt. Make sure it doesn't have any added sugar, and also natural applesauce. Again, make sure it's natural. Make sure it doesn't have any added sugars, because if you have too much sugar during this period, you will you risk of getting dumping syndrome, and that will give you nausea, vomiting, diarrhea. So you don't want to have too much sugar, especially in the first 2 weeks because of this. Avoid high sugar flavored yogurts, ice creams or sorbets. Avoid them. Smoothies, for example, for Jamba Juice, avoid that too. They have a lot of sugar. They have a lot of extra added stuff in it that you don't want at this point in your healing process. Avoid store-bought baby food. These have a lot of added sugar usually. You can have natural applesauce if you'd like. Also, avoid carbonated beverages. Like I said, they will cause pain. This is a lifestyle change that you have to keep up with. Some people, after they fully heal, can have carbonated beverages, but not everybody. So just avoid them for now. These are some examples of some foods that you can make. You can make cooked oats with a scoop of protein, cinnamon and peanut butter, optional. This is how it would look like. You can have some creamy vegetable soup. And also you can make a peanut butter protein shake. You can buy the PB Fit or any kind of powdered peanut butter, pretty much. You can add some non-fat Greek yogurt, unsweetened almond milk, scoop of protein, and ice cubes, and that's a great shake right there. That will have a lot of flavor and also a lot of protein. I'm going to start a poll right now. Let's see if you guys can get these questions. I'm going to give everybody like a minute and a half to answer the questions. Please make sure to answer them. Another 30 seconds. All right, I'm going to end the poll. So how many ounces of fluid should you aim during clear liquids? The answer is 64 ounces. 48 minimum, 64 is the goal. Like I said, 48 ounces, it's to prevent dehydration. The goal is 64 ounces. Work your way up to it. Have a bottle of water next to you. Take small sips throughout the day. Wait a minute in between sips. Fluids will stretch your stomach. True or false? False. Fluids pass through your stomach without restriction, so stay hydrated. You can have as many fluids as you like. Like I said, water, protein water are good. Teas are amazing. And then, can you try coffee at this time? The answer is no, because caffeine can dehydrate you and also irritate your pouch. It can also cause acid reflux. So try in between 6 to 8 weeks. You can try some coffee, but if it does give you still give you a problem during that time, please avoid it for a couple more weeks. Okay, so now we're moving on to the phase 3, which is puree soft solid phase. It will last around 7 days. It's very important during this phase to stop drinking anything 30 minutes prior to eating. Do not drink anything during the meal, and then 30 minutes after the meal. Also, it's important to introduce only one new food at a time, because then if you have a problem with it, you know exactly which food caused you the problem, and you can stay away from it for a longer time. It must be soft enough to mash with a fork. Consume protein with all the meals. Eat slowly and chew your food properly. The food should be the baby food consistency, so make sure you chew it. It helps a lot with digestion. Uh, it will let your brain um, register that you're eating, so it's going to keep you a little bit fuller. And then, like I said, introduce at most one new food in each meal. Weigh your food at this time. It should be a 4 ounce maximum. Protein should be 2 to 3 ounces, fat 1 tablespoon, and carbohydrates 1 ounce. Eat 3 meals a day and one protein shake a day. That would help you a lot with your protein intake. We're aiming to increase our calorie intake at this point. If you're having 800 calories during this phase, it's okay. Try to aim closer to 1,000 to 1,200. During this phase, you can have things like cottage cheese, avocado, canned tuna with mayo or Greek yogurt. You can try some scallops, poached or scrambled eggs, baked salmon, braised beans, braised meats. Make sure that you cook them until they fall apart. Well-cooked vegetable and soft tofu. You can also try canned chicken, but make sure it's very moist. And then avoid raw veggies, white bread, steak. Steak usually it's very tough to digest, especially during this phase. Avoid popcorn at all costs. Popcorn can get stuck in your staple line and it can create complications. Hot dogs, cookies, desserts, any kind of processed products and snacks, just try to avoid them. Here's are some more options for meals. You have an avocado chicken salad. You have the ingredients right here. Low carb pork roast. Again, make sure you really cook it through until it's fall apart, the veggies and the meat. Or a cottage cheese egg salad, which is just hard-boiled eggs, cottage cheese, and some seasonings. It's a great, very easy to digest meal that has a lot of protein. So you can give it a try. Now we'll be moving to phase 4, which is solid phase. Now you're pretty much healed up. You can start trying the foods that you used to eat. Again, the same thing. Introduce only one food at a time. Make sure your stomach agrees with you. If it doesn't, just wait a couple more days after. Try to have a variety of foods. You should be able to digest most soft solid items by now. You can try any firm foods you want. Continue to chew to applesauce consistency or baby food consistency. And then, like I said, some foods, even if you're in phase 4, some foods might not agree with you. So just if something like that happens, wait another couple of days, try it again. If it keeps happening, wait until you can't eat that. And then now at this point, the long-term intake goal, make sure that all your meals have at least 3 ounces of protein, 1 to 2 tablespoons of fat, of healthy fat, so like olive oil, avocado, and then 2 ounces of carbohydrates. Carbohydrates should be coming from veggies. I know you can still follow the pre-op guidelines to avoid starchy foods because that will help you lose weight faster and for a better result for your surgery. These are some common food triggers for the first 3 to 4 months. Raw veggies will be are a big thing. Scrambled eggs. Eggs are notoriously hard to digest. You can try them in phase 3 and see if you agree with them. If you don't, just keep waiting a couple more days. Tough meat or chicken, white rice and regular pasta, untoasted bread or white bread. Again, carbonated drinks, avoid carbonated drinks. And then also nuts. Nuts and seeds, wait 8 weeks before you try them. Both of them can get stuck in your staple line and create complications. So this is a scenario. So what's wrong with this scenario? Today is your first day of soft solids. You have not tried any soft solids yet. For your first meal, you decide to try cottage cheese and a poached egg topped with avocado. So the problem in this scenario, you're introducing three new food items. Now, if you have a negative reaction to it, you don't know which food caused it, which is why I've been saying try only one new food at a time. In scenario 2, you're scrolling through Facebook support group. You see a patient with great weight loss stats. You have to know her secret. So you ask and say she's been weightlifting at 3 weeks post-op. You think to yourself, that sounds premature, but she seems to be doing okay. You decide to ask us, and then we tell you you have to wait 8 weeks until you do any kind of strength training. So there's actually nothing wrong with this scenario. The patient that asked us for the guidelines is right. If somebody does something that earlier than it should be and they're fine with it, it doesn't mean that you're going to be fine with it. So please try to follow the guidelines and just take it slow. You're healing at this point. The weight loss will come with time. So nutrition goals, 1 month and beyond. How much should I eat? Everybody tolerates different amounts after surgery. Normal ranges are from 2 ounces to 8 ounces after 1 year. It's normal to be able to eat more in volume as time passes. So if at a month in you can only eat 4 ounces, that's fine, that's perfect. You will be able to eat a little bit more as time passes. Please keep the meals no more than 4 to 6 ounces in the first 6 months. You can use the food scale and measuring cups to measure. If you introduce too much volume to your stomach, it can stretch the stomach and create complications. Don't force yourself to eat more than it feels comfortable. You do not want your stomach to stretch. It will damage the nerve receptors in the stomach, and you feel hungry more often if it does stretches. Focus on oils and fats, healthy ones, so avocados, olives, nuts and seeds, but that's 8 weeks after. Nut butters like peanut butter or almond butter, olive oil, grapeseed oil, flaxseed oil, avocado oil, all of them are good options. For proteins, you can try things like seafood, Greek yogurt, poultry, lean meats, cheese, egg, tofu. And for carbohydrates, like I said, try to focus on complex carbohydrates like sweet potatoes, vegetables, fruits. Beans and legumes are also very good carbohydrate source and a protein source. So these ones are very good for both of them. Whole grains, oats, and this right here, Ezekiel bread. It's a bread made with no flour. Wait 8 weeks until you try this because it does have seeds in it, but it's a very good bread. It's also a complete protein, which not a lot of breads are a complete protein. This is a sample meal for a normal day. 1 egg, 1 slice of Ezekiel bread, 2 ounces of vegetable, and 1 tablespoon of fat. Protein shake as a snack. For lunch, 3 ounces of protein with 2 ounces of vegetables and 1 tablespoon of fat. Snack, you can have some almonds or berries or a cheese stick. And then for dinner, the same thing. The intake goals for 30 days and beyond is calories between 1,000 and 1,200, proteins between 75 grams and 105 grams, carbohydrates less than 100, fats between 30 and 45 grams, sugar less than 25 grams, but this is added sugar because, for example, fruits have sugar, but it's not considered added sugar. And then fiber more than 20 grams per day. Here we have some tips and tricks. Do your own research. You can Google most of this stuff. You can ask me questions. I can help you with them. And then prioritize fluids, protein, and then healthy carbs in that order. Make sure you stay hydrated. Make sure you eat your proteins first, and then you can eat your healthy carbs. Be patient and exercise. You can exercise, you can do light walking as soon as you get out of the hospital, and that's perfect. But if you want to do something more strenuous, like lifting weights or any kind of other activities that are harder to do, wait 8 weeks at least. Uh, Make sure you have a positive mindset. Food is for you to nourish you. You don't have to overeat. As long as you feel full and you feel comfortable, don't overeat or don't try to um, meet the goals if you don't feel like you have to. Keep up with your vitamin regimen, blood work. It's good to have your blood work done every once in a while to make sure you're not getting deficient in any of the vitamins or minerals. And also realize that health is not all about the scale. Um, some patients will weigh themselves every day, and then as soon as like a little bit of weight is gained back, they start to get scared. So you can weigh yourself, but do it maybe once a week and do it at the same time. So for example, if you do it in the morning, keep it like that. Water weight can vary a lot. So if you see like 2 pounds gained, it might be water weight. Make sure you measure all your food and then keep up with your energy and health improvements. So make sure you take your vitamins, make sure you eat your protein, stay hydrated, and then 30 minutes of walking. Even if you can't do any strength training, walking is a great um, working out. It's just great. How fast can I return to work? So if you have a sitting job, 1 to 2 weeks for gastric sleeve, for the RNY bypass or mini bypass, 1 to 3 weeks, and so on. You guys can take like 30 seconds to read this. Now let's go on to the vitamins. It's important that you discontinue all vitamins 2 weeks prior to surgery, and you can begin the bariatric vitamins 14 days after the surgery. Why are vitamins important? They help with fatigue, muscle and hair loss, blurred vision, nerve damage, cracked and dry skin, overall health improvement, and weak and brittle bones. These are the ASMBS guidelines for bariatric patients. This is how much you should have for thiamine, 12 milligrams, for zinc, 15 milligrams. Calcium citrate depends if you have the gastric sleeve or the bypass. If you have the gastric sleeve, this is the number that you're looking at. And then if you had the duodenal switch, this is the number you're looking at. Vitamin D is 3,000 international units. Iron for males is 18 milligrams, for females is 45 to 60. And then vitamin B12, you can do this a couple of ways. You can do 500 to 1,000 micrograms sublingual pill. So that's a pill that you put under your tongue and you just let that dissolve. Or you can have a 1 cc injection or nasal spray. The recommended vitamins. Bariatric multivitamin is the most important. Make sure you get the bariatric specific one because they have a lot more of the amounts that you need. For gastric sleeve, the first 6 to 12 months is important to take. For bypass and DS patients, you should take them for the rest of your life. Iron and vitamin C. Vitamin C helps with absorption of iron, and do not take iron and calcium at the same time. They compete for absorption. Calcium citrate plus vitamin D. It's important for it to be citrate, not carbonate, because citrate absorbs a lot better in your body than carbonate. And then vitamin D helps with the absorption of calcium as well. And this is the sublingual B12, vitamin B12. Shots are acceptable to your PCP. I think that's like a once a month shot that you take, but you would have to contact your PCP. And then oral supplements should be sublingual. Like I said, let it dissolve under your tongue, and because that way it just gets absorbed through your blood, and you don't need any stomach acid to help with the absorption. All this depends on the brand of vitamin that you get. Our brand Emerge covers our requirements through these 4 vitamins, and I can tell you a little bit more about this in a second. So hair loss is a big thing after the surgery. So you need to make sure you take your vitamins. It can happen due to rapid weight loss, lack of protein and calories, bad quality vitamins, and just a misunderstanding of vitamin schedule. If you do buy the drinkable vitamins, this is a sample schedule for it. In the morning, you have 1 scoop of the drinkable multivitamin. At 12, you get your iron plus vitamin C and the B12 supplement. And then, like I said, iron and calcium, take them separately. At 2 p.m., you take calcium citrate, and at 8 p.m., you take another scoop of the vitamins. And this is for the chewable. So the Emerge chewables, the vitamins that we work with, they're bariatric specific. They have a lot more amount in it than the regular vitamins. So bariatric vitamins have usually 4-to-1 ratio of vitamins compared to the normal vitamins. And then to fill all your vitamin requirements, you need iron, calcium, multivitamin, and B12. They're very easy for your body to absorb. They use sugar alcohol, so you don't have any calories. The generic chewable and gummy vitamins are too high in sugar. They have like 2 to 3 grams of sugar per chewable or gummy. So and like I said, for gastric sleeve is recommended for the first 6 to 12 months post-op to keep taking the vitamins. And then for the bypass and DS patient, it's a lifetime. If you decide to buy the vitamins from our store, we have a couple of options. This is one of them. The strawberry one is very tasty. I tasted it here because we have some samples. It's like a Starburst. You chew it, it's a gummy. It's pretty good. They fill out your vitamins and they're easy to absorb by your body. This is the infusion that I was talking about. You have to take 2 scoops a day. You have to combine it with multivitamin and some calcium citrate, 4 grams of soluble fiber, and 500 milligrams of electrolyte blend. The vitamins in liquid form are easier to drink, but you do have to take a little bit more. And then the liquid formulas usually do not upset your stomach. This is a meal replacement. This is good if you want to replace a meal after post-op to make sure you get everything you need. It has 27 grams of complete protein. It has some calcium, zinc, biotin, which helps with your hair. This specific one has 15 servings. It has less than 5 grams of sugar, and they have really good tastes. So if you want the perfect bundle, this is what I recommend. A complete multivitamin with iron and calcium citrate. This will take care of most of it. And then if you want to, you can take the sublingual vitamin B12 on top of them. It's not required. Like I said, these two will meet all your requirements. You take the multivitamin twice a day and calcium 3 times a day. Because 1 tablet of calcium has 500 milligrams, and you need 1,500 for gastric sleeve, and a little bit more for the bypass or the DS. This is a comparison of our vitamins with the generic vitamins. As you can see, thiamine, for example, which is one of the vitamins you need after the surgery, the Centrum adult multivitamin only has 1.5 milligrams compared to ours that have 12 milligrams, and then the gummies don't even have any thiamine in it. Same goes for folic acid, biotin, and vitamin D and zinc, and also calcium. The drinkable has some calcium in it. These other ones don't. Like I said, they compete with iron, so even if you take them together, the chances of them not being absorbed is high. Flintstone vitamins, I get this question, yes or no? No, they don't have any thiamine. The folic acid is low. Zinc is not sufficient. Vitamin D is too low, and they have 3 grams per 2 gummies. So 2 gummies, you take 2 gummies and have 3 grams of sugar that you don't need. And I get the questions about patches a lot. Patches are not very efficient. As there's studies done on it, they don't absorb as well. And as you can see, 82% in the patch group were having at least one deficiency compared to 40% in the pill group. And it's just pretty much, they're not as effective as they should be. If you want to just have some, you can, but make sure you supplement them with the actual multivitamin. For improved digestion, I recommend a digestive enzyme. Papaya extract is usually the best one. So after the surgery, you don't have the same digestive enzymes, so you can supplement them. This will help with nausea and will also increase your absorption of nutrients. They help break down food and digest food. And like I said, I recommend the over-the-counter papaya enzyme. Also, I recommend probiotics. If you do choose to get some probiotics, make sure they have at least 50 billion CFUs or higher. And also make sure they have as many strains as possible. This will help create a healthy balance of bacteria in your gut. It helps with digestion also. It will boost your immune system. And studies show that higher amounts of weight loss happens with people that supplement with B12, with the probiotics. And also probiotics help with the higher absorption of B12. Some brands I recommend are Align and Garden of Life. We'll have another check. I'm going to give you guys a minute to answer these questions. I'm going to launch it right now. Go ahead and answer them. Okay, good job. Most everybody got it correct. I'm going to end the poll. So, which two vitamins can you not take together? The answer is calcium and iron. They should be taken 2 hours apart from each other. They compete for absorption. So if you take them together, your body will not fully absorb them. This can result in possible deficiencies. Why are probiotics recommended? They help create a healthy balance of bacteria in your gut. They can help you keep you regular. They may help support weight loss and B12 absorption. They improve digestion. Will over-the-counter vitamins be sufficient? The answer is no. They do not provide an adequate nutrient levels for bariatric patients, and you will get some nutritional deficiencies if you use over-the-counter vitamins. These are some great resources that you can look into. We have a podcast done by our past patients. You can get their perspective and experience of having surgery with us at MBC. Some example of episodes that they have is the post-op diet, exercising after weight loss surgery, weight loss stalls. This is a big one. They talk a lot about it. Fast food and returning to work after surgery. They're available on YouTube, our website, Spotify, Google. They're available everywhere. This is very great. Sarita and Rena, they're the ones doing it. They have a lot of information there. So make sure you check it out. And then here are some more resources. The blog that we have at MBC, the MBC YouTube channel, the MBC support groups, Instagram and TikTok. Make sure you check them out. They have a lot of good information that you can use. Okay, now I'm going to open it up for questions. So please use the Q&A to ask me questions, and I'll answer as many as I can. Brianna actually already asked me something. She said, can we get a copy of this presentation or the info? Yes, please email me and ask for it so I have a reminder. I will send you this information. Any suggestions for Bistro's vitamins for Canadian patients? I have not heard of them. I can look into it and get back to you. Um, but as long as they have the requirements that you guys saw in that little table, it should be fine. I know Canadians have problems finding the bariatric vitamins. I'm not hungry for multiple meals. Is it okay to drink protein shakes instead? Yes, but do try to have at least 2 meals a day. Um, Try to have at least 2 meals a day. Try to introduce new foods so you get used to it. But yes, you can have protein shakes. No nuts and seeds for 8 weeks. Can we have nut butters? Yes, you can. You can have peanut butter or almond butter. Just make sure you do it in week 3. And then also make sure they're not crunchy. So no crunchy or chunky like peanut butter. Always get the smooth ones. We cannot have untoasted bread, white bread. Does this mean we can have toasted white bread? What about brown rice, whole grains bread, or wheat bread? The wording was bad on that slide. I'm sorry. It's just white bread in general. Um, Brown rice is fine. Whole grains breads are fine, and wheat bread is fine. Just make sure you wait until week 4 for those. Can we have Tylenol? Yes, you can have Tylenol. Do we buy all the vitamins when we are there, or are we waiting to return home for the website? You will have to buy it on the website. Also, I just wanted to mention post-op, we offer the first month of vitamins for free, so keep an eye out for that email. Unfortunately, it's only for the US patients because we do not ship to Canada or Mexico or New Zealand. It's not advised to buy them vitamins in Mexico because they might not let you back in the country with them. Kathleen, I'll have to look into this product. I don't know about anything about it. What was the name of the probiotics? Let me see. Align and Garden of Life. Can we have popcorn after 8 weeks? No. Popcorn is a no-no. The kernels can really create problems. I suggest not eating popcorn ever after the surgery. You can try maybe like a year in if you'd like to, but I highly discourage it. Also, besides the free vitamins that we are offering for US patients, if you guys want to go to our website, here's a promo code that will give you 10% off for any kind of vitamin purchases. It's enjoy 10%. I'll wait like 2 more minutes if anybody else has any other questions that I can answer. If not, you guys can always email me, text me at the phone number, or call me. I would gladly like to help. I'm 2 weeks out. Today I just got nauseous. How can I help it? Was it food that got you nauseous, or is it just a regular nauseous feeling that you have? If there's food, the foods are causing it. Take a break from the specific foods. To help with nausea, make sure you take your antacids that you received at the hospital. You can try the papaya enzymes. Those ones can help with nausea. Make sure you take your vitamins also. Stay hydrated. Yes, 14 days post-op for vitamins. That's correct, Tammy. Monk fruit is okay. Yes, I recommend monk fruit as an artificial sweetener. Desiree, email me so we can talk a little bit more about it. Um, I don't know why it might happen, but we can look into it and figure something out. Okay. Thank you everybody for attending. If you have any more questions, please email me and I can help you with them. I can share this information with you. And if you just have any other general questions, you can always message me and I'll answer. Thank you so much, everybody, for attending. Have a great day.